Okay, so that's why we used to say years and years ago when I was in med school, we used to classify obesity into class, like, you're overweight, you are obese, grade stage one, like class one, class two, class three, above 40. We still do that just because of some technical research purposes and maybe some insurance purposes, but not anymore. So it's not BMI anymore. What we have now gone into, it's obesity stage. So obesity stage tells you that if you have a fat, like increased accumulation of adipose tissue, is it impacting your health? And we have divided health into three main categories. So is it affecting your medical or metabolic health? Is it affecting your mental health and functional health? But I want to tell you that it is proudly Canadian. So this system has been actually introduced by a group of researchers from Canada. So call it obesity staging system. And then we would stage a person into none to 0 to stage 4, depending upon what. If you're diabetic, you will go to stage 2. If you have depression, anxiety due to obesity, you're stage 2. So established diseases are usually stage 2. If it's a precondition, let's say pre-diabetes, at risk hemoglobin, little knee pain but not established osteoarthritis, so stage 1. And some people, even would they have a higher BMI, but they would not suffer from medical, mental and functional health, even though the stage, they would be class 3 of obesity, but their staging would be still 0. So just a recap. So maybe you can actually go over and look at the list of your medication and start giving yourself. So now is that if you haven't done that, maybe start writing that in each column here. So this is our assessment sheet. So if you are on a diabetic medication, hypertensive medication, cholesterol medication, gout medication, that means you do have a disease. You can write it, put a date here, write diabetes, or maybe the numbers here too, or you can ask me, and I can help you fill out the medical, mechanical, and mood section. And then you can write down your clothing size, and so forward, whatever the parameters of success you want to pick. There's some suggestions there, and then you can see yourself in 2 months. And even small expressions like, I feel short of breath after 4 blocks, I feel like 2 blocks, I feel short of breath, and then you see yourself in 3 months, 4 months, 6 months. And so this whole exercise that I did, let me know which color are you. Are you ready to give up the number now? Are you in the red
Yes.
zone, yellow zone, and the green zone? Okay, so now you understand a bit of how hard it is. Just go over and look for yourself. Is there anything that you can change? Because we did talk about modifiable and non-modifiable factors. So make sure that you do a little bit of brainstorming around your cause of weight loss.